Welcome to Middle Fingers Up, the show where we hold our heads high and our middle fingers higher. I'm your host, Kieran McKay. I am thrilled to introduce our guest today, Dr. Shafeena Premji. She is an esteemed women's health specialist. Dr. Premji brings a wealth of expertise, holding a Master's of Health Administration degree from the University of British Columbia and completing her medical training at the University of Calgary. She's certified by the North American Menopause Society and serves on the board of directors for the Canadian Menopause Society. And in recognition of her outstanding contributions, Dr. Premji was honored in 2019 with Avenue Magazine's Top 40 Under 40 Award. And through her clinic in Mahogany, medical clinic it is, she is dedicated to providing exceptional care to women across all stages of life, from preconception to menopause. And there's like a long list that this is just the short summary because she has the longest list of all the wonderful achievements possible. So I'm going to welcome you and ask you, Dr. Premji, if there's something that maybe you want to highlight or add that we didn't put in here.
I'm also a proud mother of two beautiful boys who are now 5 and 2 and have a lovely husband who has truly supported me in every pathway of my life and has allowed me to get to where I am today. So I just wanted to say thank you to those 3 of them. And of course, very supportive family, my mom and dad as well, and my sister.
Aw, I'm glad that you shared that. It takes a village, they always say. And it's nice to look back and reflect on those that are in ours and that sort of help shape us and get us to where we are. So that's lovely. Little shout out to your family. But we're not kidding. You have a long list of training. You have put so much time towards what I feel is one of the most underrated topics, issues, healthcare issues, whatever we want to call it. And so the fact that I'm sitting across a South Asian woman who has dedicated all this time to something that is such a taboo even in our community, let alone probably all of our communities across the world, not internationally. I just want to thank you for giving me some time, giving our platform some time to talk about some of the things that a lot of women in my circle are confused about or wondering about. So really, really want to acknowledge that we appreciate you here today. So I'm representing them. And hopefully I can do a decent enough job. So thanks again for being here.
Thank you, Karen, for such a warm welcome and for the opportunity to be here with you today.
Aw. All right. Okay. So you're here. We're doing this and we're going to get into it. I also want to disclose that Dr. Shafeena has taught me how to successfully chase after guests and get them on. So I will credit her as I continue to do this with all the guests that can have a really hard time to schedule. We always say thank you for your time for a reason, even to those that are listening, because we only have so much. We have to allocate it and prioritize it. And you were great at committing to coming on. So a little bit of how I know you or heard of you. I had a friend when I started the podcast back in November 2022 that told me you would be a really cool guest to have on. I looked you up. I got hooked. I got excited and super proud, like I said, that you were dedicating this time to the female anatomy. So I'd like to know for you, like, where does this inspiration come from? What's the origin story behind this time you're dedicating to women's health?
You know, it's a very interesting question because it's hard for me to identify one specific point in time or event in my life that may have helped me to get to where I am today. But what I can remember is that when I was a very young girl, my mom really made me and got me involved in lots of things that young girls do. So she would buy pretty dresses for me. She would do my hair pretty for me. She would do henna for me or mehndi for me. And so from a very young age, I just loved being a girl. And then that kind of took me into the pathway of becoming a dancer. So I was dancing at a very young age. I've done classical dancing, Indian Bollywood dancing. And then if I look forward, I then started modeling as well for some period of time. And then I actually landed in a pageant at the age of 21. So I won the Miss Alberta South Asia pageant in 2003. I also competed in Miss India Canada as well as in Miss Universe Canada. So from like the very young age to teenage years and into my early adulthood, I was always involved in things that women did and girls did. And so I think there was a lot of drive for me internally to applaud what women can do. And when I wanted to go into medical school, actually, I thought I wanted to be a pediatrician initially. But when I did a pediatric block and saw so many young, sick children, I think that became more difficult for me than I thought I was going to experience. And so the idea of watching women give birth and labor became very exciting to me. And I think that's really where the drive into entering into obstetrics and gynecology and women's health really continued to flow for me. How I ended up in the world of menopause care was kind of a coincidence. Once I completed my family medicine residency, I did a full 1 year women's fellowship. And I ended up in Ottawa for 2 months. And I was in the office of a wonderful physician named Dr. Elaine Jolly. And she was probably in her late 70s and still practicing medicine. She was the president of the Canadian Menopause Society. I'd never heard of this society before. And she was providing a menopause clinic that I happened to fall into her office and into her clinic for about a month or 6 weeks. And the work that she was doing and the way that she was providing such compassionate care to women in a way that I had never experienced before was very enlightening to me. And I remember one day she took me in her office at the end of the day and she said to me, Shafeena, if you want to make a difference in women's health, I want you to learn about menopause. I want you to learn about mature women's health. I want you to write this examination. I want you to attend this conference. And I want you to make this a part of your clinical practice. And I took her words to heart, and I did exactly what she told me. And because of her inspiration, her mentorship, and her guidance, she has allowed me to get to where I am today. So I'm very, very grateful to Dr. Jolly. She's no longer practicing, but I keep in touch with her, and very grateful for her for allowing me to enter into this space.
Yeah, that's amazing. For you, when you look back now, do you feel like you understand better now that you're in your 40s as well, in terms of why she was so adamant or really encouraged you or told you essentially to follow that pursuit?
Now that I'm doing this work, I realize that there is such a lack of knowledge, education, and there is a huge gap in women's health. As women, when we are in our adolescence and young teenage years and older teenage years, we're given the information about how to access birth control, how to prevent pregnancy. And then when we're thinking about getting pregnant, we're told about, okay, you need to have folic acid, you need to be tracking your cycles, this is how you get pregnant. And then once our pregnancy is ended, we're taught about breastfeeding, if we're able to successfully breastfeed. If not, our periods come back. And then we're talking about, okay, so how do we prevent pregnancy again? What are some of the long-term contraceptive options available? And then that's it. Mm-hmm. Women essentially become like, okay, your job is to procreate and then not to procreate. And what happens to you after you've stopped having children? Your health, your hormones, your reproductive health is of no longer of importance. As women, now we're just expected to be mothers, wives, children, taking care of our jobs, our careers, our households, and our own health no longer becomes important. And now that I'm doing this work, I realize that woman after woman, appointment after appointment, every women's story is the same thing. And we are not given the education and the support and the knowledge about how to be empowered in the next chapter of our life.
Mm-hmm. Oh, I think you say that so well. And you can see me nodding my head like just yes, yes, yes. I can imagine so many women that are listening right now are probably thinking, thank you so much for saying that. I feel even many of us can relate to this, is that we're taught to behave and be the good little girl we're supposed to be. I know for sure in the South Asian culture, I would imagine others can relate to this too. And then, as you say, we get older, we have babies, all these things that we're supposed to do according to our timeline. And then afterwards, it's this forgotten place that we're in. And I think that's the time we're supposed to really understand what it means to find joy, care for ourselves, catch up with the things maybe we had to leave behind while parenting. And yet we're never taught to care for ourselves. So the thing that we need most from a child on, many of us don't have that. What advice would you give to women or, even to your sister, women yourself about that place that when we get to our 40s, 50s is supposed to be this great time to thrive, yet we are forgotten, in the social media world too. We're not young and the most beautiful 20-year-old anymore. And then as well as when it comes to our health, it's just a aftermath when we have these conversations. So what advice would you give to us when we get to this place and feel discouraged about putting ourselves first when it comes to our health?
Stacey London from What Not to Wear.
Oh my gosh.
She's going to be, you know her.
Clinton and Stacey were my 20s. Yes. I still reference them.
I love their show. So anyway, she is doing a documentary that I've also been featured in. It's called Paused, and it's coming out in 2024. But in the trailer, she says menopause needs a makeover and midlife women's health needs a makeover. And I think now as a 41-year-old woman, knowing that I am approaching perimenopause and or menopause, I am trying to do all the things from a lifestyle perspective to allow me to transition more smoothly into that next chapter. And really, it just means about making ourselves a priority again. And by taking care of ourselves, we will be able to better take care of our families and our work and our children and our parents. And so, it sounds kind of like, oh, I already know this, but really diet, nutrition, sleep, stress reduction, mindfulness are really the most important things that we can be doing. And it's really easy to say to do all those things. But if you can line up all those things and make those important priorities in your life and in your health, you will be leaps and bounds ahead than somebody who does not make those changes.
Yeah.
And that means that you are also being screened by a family doctor or a healthcare provider, ensuring that you know what your cholesterol levels are. Do you have diabetes? Checking your blood pressure, having a baseline mammogram done. Women think we don't need mammograms until age 50, and that is not the recommended guidelines anymore. Every woman should have a baseline mammogram at age 40 because breast density is what you can only determine on a mammogram. And having increased breast density not only increases breast cancer risk, but it also increases the risk that a breast cancer could be missed on a mammogram. So women need mammograms and breast ultrasounds. On top of it, women who drink alcohol, women who may be drinking socially when they're out with their friends don't actually realize that there is a lot of harm with alcohol consumption. 2023 new guidelines in Canada came out that 0 to 2 drinks per week is considered low risk, and anything beyond that is not considered safe and increases the risk for cancer. Women don't understand this. Smoking cessation, very important. Our diet's extremely important for our skin and our health, our skin and our hair as well. So, the things that we used to be able to eat in our 20s, we can't do that in our 40s. Our metabolism starts to drop. Our body composition starts to change as well. So if we have understanding of how our metabolic rate and how our bodies change because of our hormonal changes and just natural aging, if we have that understanding, then we're going to be allowed to better prepare and make the appropriate lifestyle changes to counteract those effects, or at least to ease the burden of them.
Right. And so these are the things that you were saying a few minutes ago that you're using to help prepare you for this transition in your 40s leading to your 50s. And when you have your patients come to your office, is this news to a lot of women that sit there before you in your office and you say this to them? Like, what is your typical response that you get back when you say, hey guys, like, we got to look at these things, these factors in our life? What do you usually hear back with that?
Well, here's the interesting thing. I actually get few opportunities. I get few opportunities to do this. And the reason why is that our healthcare system is set up in such a way that women think that between the ages of 30 to 35, when they've stopped having their children, to 50, women are not getting regular physical examinations with their family doctor. They think, oh, I just need a pap test every 3 years. That's enough, right? I need to get my refill for my birth control pill. That's enough. So they are actually not making any preventative healthcare appointments with their family doctor. I am at the end of that because I'm a menopause care specialist. So I'm only getting the appointments when women have now realized they're having symptoms when it's a bit too late. So I'm actually missing out on that 35 to 50 your range, because those women are not accessing their family doctors. And even those who are accessing their family doctors, family physicians and OBGYNs are still undereducated about how to support women in midlife. We are in 2024 and we are still so behind.
Okay, so you saying that as a doctor that went to doctor school makes me feel so much better, because that is what the conversation is typically with a lot of the women, and sort of are sharing the same things as I am with perimenopause and some of the hormonal stuff that we're going through. And we're like, are we just supposed to know this? Like, I said to you before we started recording, I'm like, look, I was born and raised in Canada. I received my education out here. You would think I would know how to Google these things or pay attention to these things. Yet something sometimes still gets in the way for me to recognize that, oh my gosh, these are the things that could, if I just start at the basic needs, essentially, it's the sleep, it's the sleep hygiene, the diet hygiene, all these sorts of things that you're mentioning are going to impact us when we're in this transition. But I want to say I'm surprised to what you're saying. It's more disheartening than surprised that so many of us are exactly what you're saying, not in the place to recognize I need to go, or are lacking some of the validation that, there's even worth to go and check this out. We kind of miss that piece. And then, as we hit our 50s and 60s, now we're just going back to the doctor for pills because we're hurting our legs and our arms and our headaches and all that stuff. And so what would be the way as a society we can help, I think, support women's health? Because I would say society plays a really big role as well in teaching us that we don't need to look after these things. Even when we do go to the doctors, if we don't ask sometimes, because we don't get, we get 15 minutes, we don't get an hour, we don't even know what to ask. And often you have to show up knowing your stuff as well with, okay, hey doc, I need this sort of support or help. So is there something, as if there's one thing that those of us that suck at going and taking care of ourselves in this way, what is the first step that we could take in terms of starting the journey of looking after our health?
I think that this is a very loaded question, and there's so many parts to this question that I wish I could, answer them. But I'm going to tell you where the challenges lie. Okay, the challenges lie as a family doctor. We first of all have very limited education about how to support women in midlife. So, I have sought out this information on my own, and it's been 10 years of patient after reading and learning that I have finally felt that I'm in a place that I can support women as best as I can with the knowledge that I have. But that is not the typical family doctor, right? We as family doctors are expected to know a little bit about everything.
Yeah.
And menopause hormone therapy has fallen off curriculums for over 20 years because of a fear around hormone therapy. So women are scared of hormone therapy, physicians are afraid of hormone therapy, and there's a lot of benefit that women don't understand. So when you're going to your family doctor, there's a lack of knowledge and education, and it's not their fault. It's the medical system's fault. The second thing is that menopause care and preventative health care is not well remunerated. So the government is not going to pay a doctor well in order to provide the time to do the counseling that's required to do all the things I've just mentioned to you.
Yeah.
The third thing is when someone comes in with sleep disturbances or weight gain or mood changes, you're going to be prescribed an antidepressant, a sleeping drug, or maybe something to help with your weight. But maybe it's all hormonally related, and it's really hard to put that together. So I think what a woman can do to take the matter into her own hands is to become knowledgeable and to educate themselves and to be more knowledgeable than even your family doctor. And that's okay.
Yeah.
If you're going to your family doctor and you now know what to ask for and understand why you're asking for it, then they're not going to, I feel that they shouldn't hold you back from requesting those things.
Yeah.
So, the one thing that I would say is book a preventative healthcare appointment and get some basic lab work done. Have your diabetes levels checked. As a South Asian woman and our community, we're at higher risk of developing diabetes, stroke, heart attack, high blood pressure, and high cholesterol. Even if we are, skinny fat, we still are at risk. And then I find that when you go to a gym, how many of those women that are in the gym, it's primarily men, But of the women in the gym, how many of them are South Asian?
Mm-hmm.
So few.
Mm-hmm.
So do we as women even know how to exercise? There's always been this emphasis on cardiovascular exercise, like pelotons and bikes and running. But actually, what the most important part of our exercise should be actually weight training and strength training and adequate protein intake. It's not about being skinny anymore. It's about being strong.
Mm-hmm.
And we don't know that. And this is all new research that's coming out. So I talked about exercise and diet. Those are two very simple things. Strength training 3 to 4 times a week, progressively increasing your weights, and then having adequate protein, but also sleeping well, right? That's another big part of it. So there's lots of things that we can do, which sound kind of intuitive, but we just need somebody to write out a midlife care plan. What do I do?
Yes, right. That could be what your podcast, when you get it going, could be honestly helpful of, okay, like here's your doctor's note of what you guys need to go and do, because we are in the world of self-learning, and I'm grateful that my kids are understanding that, and they're going to get it a lot better than maybe my generation. I don't know about the one below, but it's hard when you grow up in a way of authority, like let's say doctors, and they always know everything, and that's sort of what you're taught. And we are in this place now where we do have to, like you said, know a little bit more because our family physician is the general doctor. And we have to figure out who it is, what specialist and what person to go to. And so I appreciate what you're saying is like, it's okay to go in there knowing a little bit more. I also hear you saying some of these things that you're talking about, diet, exercise. Those of us that are entering our 40s, we're doing a lot of unlearning, because in our 20s, it was all the opposite reasons. You work out to be skinny, you eat this meal to, again, be thin and all that. And I love what you're saying. And in my personal journey, I've been here too, is rescripting this place of, like I am going to work out. My mom gave me this advice a few months ago and said, like your working out now should no longer be about what you look like. It should be about prevention, so that when you do twist your ankle or break your arm down the way or your hip, you're going to have this, or you're in a car accident, you're going to have the strength, and that's what you need. And so I think that's important for us to hear from you about. We have to sort of reshift some of the things that society has taught us about why we're doing the things we're doing. Those things aren't serving us in the way that we thought they were. We have to do it to build the strength and the longevity. If I could just switch for a second to the social piece, I want to talk about our partners. So those of us that are going through some of this process and transition and change in our 40s, 50s and up, some of us are in relationships. And when I hear a lot of the women in the group talking about some of their struggles, and I also want to give them a shout out, because there was a group of women that I have talked to individually who inspired this conversation with you today. They were brave, they spoke up, they shared some of the things that we're taught not to. And because of them, you and I are talking today. And I'm grateful for that validation through them. And sometimes when we're talking, I think about our partners. And so I just want to talk about what are some advice or some support you can offer in terms of what our partners can do to be helpful. Sometimes it's scary for them to see, I'll use my husband and I for an example. This is my wife, Kieran. These are her values. These are the things she loves. We've been together for 1,000 years. Now, all of a sudden, Kieran wakes up and it seems like she might be a monster and doesn't like those things and believe in those things. And I'm being cute and making it playful, but read between the lines, right? Like it can get intense sometimes when I'm like, I don't even know why I'm this angry. I don't even know why this is going on. No, I'm not getting my period this week. It's just something that's happening. So is there something you could offer for those partners of ours that are helping to, go through this, or our family members?
I have 2 things to say about this. The first thing is, if you are a woman who has had children and your husband has been there to watch you through pregnancy, labor and delivery, and postpartum, he will have already had a window into what perimenopause and menopause looks like, because pregnancy, labor and delivery, and postpartum is a time when women's hormones are all over the place. And all the feels that we feel are happening because of hormonal changes. But the difference between pregnancy and perimenopause is that they see physical changes because we're growing a bump and then our bump goes away. When you are in perimenopause, all you see is the same woman with a lot of personality changes, maybe a bit of weight gain, and then it's like you're not taking care of yourself anymore. So then it's a blame, right? When actually this is a physiologic transition that is occurring. And we actually know that women who have perimenopausal depressive symptoms are more likely to have those symptoms if they actually had postpartum depression and anxiety. So there's a lot of hormonal fluctuations that are occurring physiologically that is explaining why these behaviors and turning into a monster is occurring. Now, one thing that I would say that I think is amazing that I see very, very infrequently is that when women come for their menopause consults with me, I've been doing this, like I said, for over 10 years. I see 3 to 8 consults per week. I've seen a male partner attend their female partner's appointment 3 times. 3 times. So I would say if there's one thing that a male can do to support their partner is actually to come to the appointment. The husbands come to the 1-week postpartum visit with their wife after they've given birth. Why are they not attending the next big journey as well? So I think that if a male partner wants to support their wife, they should be coming to those appointments because there's a lot of information that they will learn just by listening, because the woman is going to be talking and openly sharing her story. They may not have that opportunity to talk about that at home. So I think that would be one of my advice is to have the partner actually attend the appointment with their wife.
Oh, that's brilliant. It's one of those things that I'm like, why didn't I even never think of that? You just don't think of that. You never think that's an option or that you should. And I think that so many people listening are going to feel validated about, okay, like this is a bigger deal than we let on. And even if society isn't caught up to where I am with my hormones right now, I think we all have to give ourselves some compassion and some grace period. And this is not an easy transition to go through. And I really appreciate you saying if women did have a child, before this menopausal state, that's a good place to go back and reflect because there are going to be some similarities. And I think, oh, that's great because that'll also help me prepare as I'm entering this stage because there were a lot of irrational moments about wanting hot dogs and things that we didn't know where they came from. And now I'm like, oh, this is why I'm doing some similar things now where I don't know why I'm upset at this. So that is really helpful to hear. And I think, our partners are the beginning of this bigger part about connection. And I was watching on Instagram or something like that the other day, a video where a neuroscientist was being interviewed. In their research, they were being asked, like, what did you find in terms of the successful way to live a long life? And I think, oh yeah, it's got to be obviously exercise. But exercise was like number 3 or 4. I don't know if you want to take a guess. And if you know, maybe you do. What number 1 was?
Relationships?
Yeah. So social connection. She talked about we undermine this and it starts in our house and then it kind of, the micro and then we go to the macro with our friends and social circles. And going back to the beginning of this conversation of what sort of inspired it is encouraging us to share when we're having these moments of, oh, I'm feeling irrational, or I don't know why, but I've gained this weight, or I don't feel the same about those things that I used to. I think while we're figuring out our health journey and the complexities and trying to work up the courage to go see Dr. Shafeena, we can also be connecting with our friends or family or loved ones to open the door to these conversations. I think maybe will make us feel, quote unquote, less crazy at times. It's not just me going through it. I don't have to isolate myself.
As doctors, we diagnose and treat many medical conditions and we'll take care of many women who've had pregnancies. But if you are old enough as a woman, doctor, you will experience menopause like you yourself will be diagnosing and treating something that you're going to experience yourself. Yeah. So I think that it's very unique to treat menopausal women or just midlife women because every one of us are going to experience this. So it's a personal experience and a journey as well as supporting your patient at the same time.
Yeah, it's a parallel process.
Nobody thinks about that. Like you can diagnose high blood pressure and diabetes, you can write the prescriptions, you can do the follow-ups, but you yourself are not internalizing it.
Yeah.
Because you're not experiencing it yourself. But as a woman, you are going to experience menopause in some shape or form. Yeah. So there is some personal respect for the condition.
Yeah.
And it's not even a condition. It's a natural part of aging, but it's something that can be managed safely and effectively.
I think you keeping that right up here in terms of, yeah, like I'm also a human and outside of doctor code, I go through this too. I think is probably such a uplifting moment for so many of your patients that would feel that. Anytime my doctor has connected with me, woman to woman versus here's the medical thing, I'm like, I don't even need the meds. I just needed to know that I'm not losing my mind because I got this pain over here, and when you get that. So I feel like for you doing what you're doing and your Dr. Jolly mentor, kudos to her to put that in your head. Thank you for dedicating your time to this because it's just, and like I said, being a brown lady too. So like, when we're not allowed to have these things, don't have sex, don't talk about sex, but then go have babies, but then get married. Like, like, and then they don't teach you. And then you're like, right. So that's good. Okay. So anything that you wish today that we talked about, I know we had a little tiny moment together and I would love to continue this conversation on with others, including yourself. But is there anything that, maybe I should have asked or you wish that we had talked about today before we send you off?
So for any of our listeners who are, even in your 30s or 40s, or now you are in menopause and you're trying to figure out how do I get help? What do I do? I don't necessarily want hormone therapy, but I want to figure out how to make those healthy lifestyle changes. And you're trying to figure out when you put your Google search in, menopause help or midlife help for women, I want to give you a couple of tips on making sure that the resources that you are accessing are actually credible and scientific and evidence-based. So I'm going to give you 3 recommendations for websites. I am on the board of the Canadian Menopause Society, and I'm also on the medical advisory board for the Menopause Foundation of Canada. So the 3 websites that I would give you would be Menopause Foundation Canada. You can actually join their email subscription, and they have a lot of excellent resources on their website. And the second one is mq6.ca. So M for Mary, Q for quiet, and then the number 6.ca. Basically, the mq6.ca is a summary, evidence-based recommendations on very common perimenopausal symptoms. And you can actually go online. There's a printable form. You can write down what your symptoms are, print it out, and take it to your family doctor. So if they have no clue how to help you, take this paper in and they can refer you somewhere where there may be some menopause practitioner in your area. The third thing that I would say is that if you are going to access a menopause care physician or a practitioner, make sure that they are North American Menopause Certified and that they are not charging you for your appointments. They're not charging you for expensive blood work, and that your prescriptions for hormone therapy are not compounded. And there's a really good North American Menopause Society has a website. It's just menopause.org. And there's a whole slew of areas there for information for women. There's 5-minute videos on there as well, which are specifically focused on patients. And you'll get a lot of excellent evidence-based information from those 3 websites.
Okay, I appreciate this. You're validating, you're sharing some resources, you're also helping many people here today understand that there is a lot out there that we can get. It may not feel that way, but if we follow these resources or we reach out or we ask, there is a possibility of being validated with support and hopefully helping us with our journey along the way. And just lastly, call to action, anything that if there's one thing the folks listening today that could take or try or do, you shared really good tips and tricks. What would that one thing be if it was the only thing people were going to take today?
I think when you have better awareness and knowledge and clarity around your healthcare needs, you're going to make better choices moving forward. And those better choices are then going to allow you to have better results as you progress from your 30s, 40s, and 50s. So reach out. As you mentioned, there's a lot of information online. Knowledge is power. And if you are reaching out to the right people, the right avenues to get your knowledge, you are going to be able to then move forward as a woman and feel confident, empowered, and educated with your choices and how your life is going to continue to play out.
Well said. Thank you again for coming on, being here today. I really appreciate your time. I am hopeful that a lot of people listening are going to take something from this. And I'm hoping that we can keep the door to this conversation open, whether folks reach out to you. I'll have your socials on if folks want. But also for those listening, starting somewhere is reaching out to anyone, friend, family member. Let us know. You can DM us if you're confused, not sure where to go. The bottom line is there is support out there for us in terms of our health. Things are happening, and I think it's really important that when those things are happening, we understand that we're not alone and there's others going through it too. And then we have folks like Dr. Shafeena who are dedicating their time to help us get some answers. So thank you again for coming on.
Thank you, Karen, for this opportunity. And from a South Asian woman to a South Asian woman, you go, girl.
Oh, man, I love it. Thank you. I appreciate hearing that.